here in the Giving Children Hope office with Becky Stone and Paul Leon, and I wanted to talk about what organizations you're here with.
Well, I work for the Public Health Department. I'm a public health nursing supervisor, and I have a unit of public health nurses who are dedicated to working with homeless children and families.
Wonderful.
And I'm Paul Leon. I'm the executive director of the Illumination Foundation. We've been in business for about 2 years, and we actually house and do wraparound services for children and families. Currently, we've helped over 154 families that came through our program, with 27 graduated into permanent housing, and we're looking forward to collaborating on a medical van.
And what would you say some of the biggest issue of why people are homeless in Orange County and what you're seeing?
There's multitude of reasons why people are homeless. Everything from drug addiction to mental illness to the recent downturn in the economy has created a lot of new homeless. And just the fact in Orange County that the cost of living is so expensive that it creates its own problems for a lot of the people that are the working poor. But this isn't unique to just Orange County. It's kind of nationwide. But we're really hit by this because of the fact that it's tough to get back into housing once you've been homeless for any period of time. Well, again, obviously, it's easier to work with people prior to them becoming homeless, because once they fall into the depths of homelessness, it's more difficult to get back into housing. One study that just recently was finished and published was saying that you would have to work 160 hours to afford a one-bedroom, at minimum wage, a one-bedroom apartment in Orange County. So that cuts out so many people, and once they lose that stable housing, they fall prey to medical, mental, legal problems. Excuse me. So it's really difficult to see them fall down. Our goal for Illumination Foundation is to try to find them before they actually enter homelessness and try to get them into rapid rehousing.
Okay. And Becky, what are some of the health needs for the homeless here in Orange County?
Well, we see a lot of the chronic needs, health needs not going addressed, the diabetes, the hypertension, the asthma. Those are the big three, as we call them. We're always coming up with that diagnosis. But just in general, people are not prioritizing their health, of course, because a place to sleep and food to eat are more important for them. So they neglect health in general, and so they let injuries get really bad. They let post-accident injuries, the trauma to their body gets to the point where it would take massive amounts and really small amounts of medical care just to resolve the issue. And they just live with these kinds of situations. The children will go unimmunized. They'll go with chronically having, like allergy symptoms or respiratory symptoms. We see a lot of respiratory illness of all different kinds.
Okay.
It's just part of not taking care of yourself. And of course, with the poor nutrition, there's no way a diabetic can eat right. Absolutely no way when you're poor. Because you take whatever you can get, and most of it is carbs, which is the wrong food for a diabetic.
And as you know, we run a program for homeless kids in Orange County, the We've Got Your Back program, that helps provide food over the weekend. What happens if a child is, they're getting that free and reduced lunch program during the week, but then they're going the weekend without food, and then they get food again? How does that affect them?
Well, it certainly affects their health, their ability to cope on the weekends. They are not going to be, probably what they're going to do on the weekends, if they don't have good healthy food, they'll probably find something to eat, but it's going to be very bad food for them in terms of what we consider the ideal nutrition for a growing child. It's very cheap to buy things like Top Ramen, or they'll scrounge up money to get something off of the ice cream cart. They do have a little bit of access to food, maybe it's tortillas or whatever, but it's certainly not good for their health in the long run. And there are a lot of children, certainly my husband's a teacher in a predominantly Hispanic and poor socioeconomic school, and where 90% of the kids are on the free lunch program. So we know very much that that's what they rely on, that's what they eat.
Right.
That's what the free lunch program provides, and on the weekends they really are hungry.
And we're excited. We're talking about the collaboration of the new mobile medical clinic and having that, working with these guys to have it out in service in Orange County. And they've been using a mobile medical clinic for a couple years now. But
About a year and a half we've been working in collaboration with a variety of partners, and what we're looking for now is a little bit different slant to try to meet the gaps and the needs in Orange County, and to keep providing this medical care. There's a lot of holes, especially for adults, but certainly children also, while they're waiting to get into a stable medical home.
Yeah, outreach is just critical, you know, so to be able to go where the homeless either congregate or staying. People don't realize that there's literally thousands of homeless women and children, single men, elderly, that are living in parks, in their cars, on beaches and parks. And people don't really realize that that's actually happening. So by going out to where the homeless congregate, it gives you a whole new perspective. So it'll just be one more weapon that we have to.
And doing the medical outreach to where the homeless are, does that help then get them into other services that are available?
Oh, definitely. It breaks down the barriers to be able to get the homeless individuals connected to the resources. Even though they're scarce, they still are available. But to make that link is crucial. And, you know, people think about, you know, so many things. And it's, as Becky alluded to, that a lot of families think of, well, I need to find shelter and I need to find food. However, when their health falls below a certain level, you can't get it back. So that's one of the things, like once you get somebody housing and they're stable, once you give somebody food, they're not hungry and they can probably get their nutritional needs met. Once their health falls below a certain level and they become chronically ill, all the problems never are able to resolve, and it's a much costlier dilemma, and it's just an overall public problem for everybody.
And if you can't, it's hard to get a job and work if you're not healthy, and
Exactly.
so it's really all tied together. So.
And the clinics, our goal isn't simply just to provide Band-Aids, and that's really, really important. That's why I'm involved as a public health nurse in this enterprise, and that's why I'm supported by the Public Health Department, because we're concerned with getting people connected with health care and a way to pay for it. So we have access to health insurance programs and ability to apply for the ones that are governmental, plus we have the knowledge base and the ability to connect them to medical care services. And my public health nurses will work with the families and the individuals who need extra hand-holding, those with complex medical issues, with chronic problems, with a history of not being able to really rise up to the occasion and juggle all these balls for meeting all their own needs. So we help them with the health piece and connect them to other resources so that they can get stable. So we have partnership with the housing, with the other wraparound services, and we try to pull it all together for them.
Yeah, that's wonderful.
Coming out to do one of their segments with the Illumination Foundation and our collaboratives.
Yes,
so
we'll be there too.
because that's one of the big things that is helping us. There's no way we could do what we're doing without our partners. And it really has been an equal partnership. It's not really one lead agency.
Yeah, we always like to say that too. You know, as an organization, we're only as strong as our partners, and that it really takes a lot of hands and a lot of organizations to make projects successful and to see people thrive. And so we're excited to be partnering with you guys and
Sounds
getting
great.
this clinic on the road in Orange County. So thanks for coming in today.
Okay,
Welcome.
thank you
so
very
much.
much.